Thousands with disabilities subjected to segregation in these 3 states. A family wonders how a cousin slipped through the cracks and wound up in a state nursing facility not long after her 18th birthday. A mother wonders how she lost her daughter to the same system. And a woman in her late 50s longs to leave a state facility to see her family again. These are among the findings of an extensive Department of Justice investigation into how 3 states, Missouri, Utah, and Nebraska, illegally segregated people with mental health disabilities. Federal prosecutors found that the states are unnecessarily institutionalizing thousands of people in state facilities, cutting them off from family and the rest of society. The investigations date back to March 2021 based on numerous complaints. I have a dream that one day I will be free to live on my own, free to live within my community, free to have overnight visits with my grandchildren, says Angela, the woman in her late 50s, in the Missouri report issued by the DOJ. The federal report quotes people by their first name only, free to not be told who I can associate with, free to not have someone place me in a nursing home and leave me, without any regard to my well-being mentally and physically, most of all just free to live my life. The investigations found widespread violations of the Americans with Disabilities Act, which says adults with disabilities must live in as integrated of settings as possible. This is about weaving people with disabilities into the tapestry of American life. Assistant Attorney General Kristen Clark of the Justice Department's Civil Rights Division told USA Today, "This is about bringing an end to the unnecessary segregation and isolation of people with disabilities in our country, and it's about recognizing their dignity, their autonomy, and their independence." The investigations were published around the 25th anniversary of the 1999 Olmstead p.l.c. Supreme Court decision, which upheld the principle that public entities must provide community-based services to people with disabilities to prevent segregation. Our work is about breathing life into the ADA's integration mandate, Clark said. "We hope that our enforcement work sends a loud message to jurisdictions about the steps that they must take to comply with the law, and specifically to comply with the ADA." The Office of Missouri Gov. Michael L. Parson did not respond to requests for comment. The state cooperated with the Justice Department's investigation, according to the report. The report from the DOJ is one in a slew of investigations that have also gone after Utah and Nebraska for similar practices. A federal investigation into practices in Utah found that the state is segregating people with disabilities by placing them in isolated warehouse-like facilities for day programs. An investigation into Nebraska's practices found the state was also placing people with disabilities into segregated day programs and segregated living facilities. In a statement, Utah's Department of Health and Human Services said it's committed to improving state treatment of people with disabilities. Nebraska's Department of Health and Human Services said it was disappointed with the Justice Department's allegations, adding that Gov. Jim Pillen's administration had already shown its commitment to improving care for people with disabilities. The 45-page DOJ report on Missouri's treatment of people with mental disabilities details how the state systematically funneled people into state nursing facilities, even though almost none needed even short-term stays. The facilities come with skilled caregivers and are commonly known as nursing homes, but more than half of the people covered in the report were under 65 and didn't require the care offered. The people covered in the report had been inside them for at least 3 years on average, and around half were clustered at just 39 of the state's 500 nursing facilities. The people interviewed in the report described prison-like conditions at the facilities. They are highly restrictive and controlled settings that isolate and segregate residents by severely limiting or entirely cutting off their relationships with loved ones and their community, the report says, preventing them from interacting with non-disabled people. The isolation inhibits residents from pursuing work or education, which the report called hallmarks of a segregated institution. "My son had a life before they took him there, and now he has nothing," the mother of a man named Kelvin is quoted in the report as saying.